of the virus. And joining me now is Dr. Lipi Roy, an internal medicine physician. And Dr. Roy, there is a lot of, I won't call it panic, but a lot of parents are afraid. They're sending their kids back to school. In a lot of cases, it's in person. How worried should people be, given what we're seeing happening, particularly on college campuses that are, in some cases, sending kids home because of outbreaks?
Hey, Joy, yeah, it's great to be with you. I'm hearing actually a lot of, and I agree with you, it's not necessarily alarm, but there's concern. And frankly, I think it's legitimate concern. We've already seen many cases of schools across the country, from the elementary schools right up to universities, where we're seeing just huge outbreaks of cases amongst children and up until college-age students. So there's concern amongst parents because there, again, and we've talked about this before, no clear plan. There's no national strategy. All the different communities are left to their own devices to try to figure this out, which is really, it's so chaotic and it's irresponsible. We need to stop playing Russian roulette with children's lives. We know that children get sick with this novel coronavirus, and now that autumn is here, fall rather, we know that respiratory viruses, including influenza, are going to be peaking. So we need to actually take action here.
And what about this idea of a vaccine? Donald Trump is still kind of promoting that there'll be a vaccine. There's been some pushback from drug companies that say, whoa, we're not going to put anything out there unless it's been properly tested. Is it even possible for a vaccine to have been thoroughly and properly tested to be safe by, I don't know, Election Day?
Random date of Election Day, yeah. Look, I'm a doctor. I'm a public health advocate. I'm a big advocate for preventive health, and vaccinations, immunizations fall under the category of prevention. I just got my own flu shot last week. I recommend it for all people. Here's the thing, though, with the coronavirus and the vaccines, the multiple candidates that are out there, none of them have completed phase 3 trials. And remember, that's the last phase, the large phase that looks at 40,000 people. And but it's not just the number, Joy. It's the timeline. You have to look at the effect of this new medication, this vaccine, over time, because you may not see an adverse effect in 40 days, but you might in 6 months, in 12 months, in 18 months. It could be a neurologic, cardiac, autoimmune, rheumatologic side effect. So that's the concern, Joy. And right now, none of the vaccine candidates have completed that necessary phase 3 trial, which can take up to years, to be honest, at least 1 or 2 years.
Indeed. Sobering, but very good information. Thank you so much, Dr. Lipi Roy. Always appreciate you being here. Thank you.